Hi, everyone, and welcome to this online town hall with California State Senator Scott Wiener, representing California's 11th Senate District, the entire city and county of San Francisco. From the state capitol, I'm Brian Green, and on this town hall, we will talk and take your questions online about the COVID-19 pandemic and all of the extraordinary adjustments that we and our loved ones and our co-workers are making, distancing and sheltering for the greater good. All of that in a quarantined California. We, of course, want to welcome our state senator. He is safely socially distanced about 90 miles away from me in San Francisco at his home. Senator Wiener, good to see you.
Good to see you as well.
How are you? How are you doing tonight?
I'm doing okay. Sorry, just trying to center my. There we go. I'm doing well. I feel very privileged that I am healthy, knock on wood, and safe. And I'm just sad for all the people who are hurting right now.
Absolutely. How are you doing? Your family? How is your city? How is your county doing as we speak tonight?
Well, I'm doing well. I worry about my elderly parents. My father is 81 with type 1 diabetes and congestive heart failure. My mother is in her late 70s, but they are sheltering in place. My sister and brother-in-law are frontline physicians at a hospital in Manhattan.
Wow.
So they are truly on the front lines, and I worry about them, but they are doing the work of the angels to save people's lives. And, in this amazing district I represent, San Francisco, Daly City, Colma, Broadmoor, and parts of South San Francisco, people are really resilient. And this is an area, a community that has gone through a lot with the HIV pandemic and other major challenges. And it's a community that deeply believes in public health. So I'm very proud of our Department of Public Health and our mayor and the strong political leadership in San Francisco and in San Mateo County and our governor who have allowed us to at least have a shot at really flattening this curve. We're not out of the woods yet.
Right.
But we are doing what we need to do, and I'm really proud of this community.
Great. Well, we want to give everyone who is watching here for the next hour or so the opportunity to ask any questions you have of Senator Wiener, get his perspective not only from the local level, but also the statewide level. As we do have several questions already been emailed or already in the queue, and we'll get to those shortly. But as you are watching, feel free, as you are watching this, right below the screen, where this live conference and conversation is streaming, you will see a prompt for your name, your location, where you are watching from, and a place where you can type in your question. And through the course of this conversation, if there's anything that's discussed that prompts you to have an additional question on a particular issue regarding this or anything else you would like to talk to Senator Wiener about, feel free to type that question in, put your name and your location, hit submit, and we will do our best to get to as many questions as we can in the body of this conversation and in this live town hall. And Senator, before we get to those questions, I want to follow up on what you just said, the fact that you're giving such deserved praise to the city and county of San Francisco, the leaders there. Really, since the beginning of this, from a month or so ago, which feels like a century ago for most of us, San Francisco and its leaders were really in the front of the curve, so to speak, from the very beginning in urging people to shelter in place, closing off non-essential businesses. I know it was tough, but it paid off, and it's probably saved lives. You want to comment on that?
Sure. And before I get to that, I do want to make an apology to my own community, the Jewish community. I am a Jew and have been my whole life. And tonight is the first night of Passover.
It is, yes.
To all our Jewish community. We initially scheduled this town hall for a different night last week, and we had to postpone it for logistical reasons because of the situation with COVID-19. And we switched it to tonight. And by the time we put two and two together and realized this is the first night of Passover, which we would never, ever have scheduled it for the first or second night of Passover, it was too late. The invitations had been mailed out, and so it was too late to pull back. So I am very apologetic to the Jewish community, to my own community. That makes it extra embarrassing. But I did do a Seder earlier tonight. I'm doing 3 tomorrow night, so
Wow.
I'm trying to atone for my sins. Um, in terms of San Francisco, yes, our city acted early. Our director of public health, Grant Colfax, Dr. Grant Colfax, is brilliant and is a veteran of the worst of the HIV pandemic, and there's no one who is more qualified to lead a community through a pandemic from a public health perspective. And he saw early on that we needed to take bold action, and Mayor London Breed agreed and showed the political leadership to take bold political action. San Mateo County also did as well, and the San Mateo County Board of Supervisors has been very, very out front. The Daly City Council. I'm very proud of the local leadership. And as we've seen around the country, when you're talking about a virus that is a contagion that spreads so quickly and so easily, days matter, a week matters. And we've seen in some other communities, like New York or others, that delayed. There are consequences to doing that. So we took bold action here. And again, I just want to commend our local community for doing that, and I think it has saved lives. Again, we're not out of the woods. It will get worse before it gets better, and if we loosen up and don't stop taking this as seriously as San Franciscans and San Mateo County residents have taken it, we could easily end up in a bad place. But we're doing the things that we're putting the building blocks in place to have good results, and our hospitals are not overwhelmed yet. I hope they do not get overwhelmed. But we are doing the right things.
Great. And before we begin the questions, I do have another question for you about you and your daily work and your life as a lawmaker right now, which has changed 360, 90 degrees since just in the last month. Social distancing, emptiness, absence contradict the very concept of governing and legislating. But I know you and your colleagues are doing your best from the district level in your communities to stay in touch with each other and do what you can. So talk about legislating in this time of pandemic and what you and your colleagues and your leadership are doing to try to maintain some semblance of normalcy, if that word exists right now, in keeping California running.
Yeah, it's very different when you are in politics, when you're in elected life. We are wired to be around people. You don't go into politics if you don't really like people. Right. And so to me, I love working with members of the community, whether it's on legislation or on constituent needs or just going to community events and interacting and talking to people. It's what I do. It's what we do. When you're in public life, in addition to working in the Capitol, being with your colleagues and being with advocacy organizations, and it's very different to spend the lion's share of your time, for me, in my very small place. And so I'm home all day, every day, except I do take a walk, socially distanced. I go to remote areas, like quiet streets, every evening to stretch my legs. And then once a week, I volunteer for a food provider, like the San Francisco Marin Food Bank, Meals on Wheels, St. Anthony's. We're going to do Project Open Hand, Shanti, because providing food for people in need, and there's a huge need now, is an essential activity. So other than that, I'm at home. During the day, I didn't know what to make of this, if it would get boring. During the day, from early morning until the early evening, I am on the phone, on Zoom, in meetings, calls, town halls, what have you, updates and briefings from the state, from the city, from UCSF, throughout the day. And the days go by so fast. In some ways, I feel busier than when we're not in this kind of situation. What's different, of course, is evenings and weekends, I don't have events to go to. So for once, I'm able to watch a little Netflix, which I never am able to do. But I'm in close contact every day with my district staff. My district staff is working really 7 days a week to respond to the very severe constituent needs around getting unemployment, around small businesses that are on the edge, around people who are just terrified and who don't have money to pay rent, don't have money for food. And so we're working with them, and I'm working with constituents directly. I'm on the phone, on social media. I'm trying to connect people to resources. I'm also still working with my capital staff. And by the way, my capital staff are also pitching in to try to help in the district because we're getting such an overwhelming response from the community asking for help. So my capital staff are pitching in. But we're still working on our legislation because we have legislation specific to COVID-19 to put a moratorium on commercial evictions. I'm working with Assemblyman Phil Ting on legislation to put a moratorium on residential evictions. But we also have work to do around homelessness and mental health and housing and wildfires. These are still huge issues that are with us. And so we're working very, very, very hard. But it's just different to be doing that work mostly from my home.
Absolutely. I'm sure this is, like you said, an extraordinary time for everybody. Dedicated public servants, even if they're not in the chambers at the state capitol or in their offices at the state capitol, still doing the work, the constituent business up and down the state. So kudos to all of you and your colleagues in the legislature and your staff. I have a lot of other questions I could talk to you about, but this is not about me. It's about the folks who are watching and who are tuning in and have submitted questions and will before we finish up. And if there's some other opportunities I have to ask you about some other things, your perspective on things going on in the district and in the state related to this, I will. But in the meantime, we're going to get to the emails that have already started to come in. And again, I encourage all of you who are watching right now, where you're watching right below, there's the prompt to send a question in, write your name and your location, submit it. We will do our best to get to as many questions as we can and as appropriate before we wrap up this town hall. Our first question, Senator, is for Jennifer from San Francisco. I am very concerned about health and safety in our prisons for staff, inmates, and the community. I'm also concerned about health and safety for our homeless neighbors. What are you doing to address these issues in the legislature and in your district? And a thanks from Jennifer.
Yeah, thank you, Jennifer, for that question. And I share your concerns on both counts. In terms of our prisons and jails, we have been working to reduce our prison and jail populations because the last thing we need is a contagion that gets out of control in our prison system or jails. So in San Francisco, jail population has gone down by several hundred. I'm going to estimate because it's been a few days since I saw the number. It was at maybe 1,100, 1,200. Now it's about 800. So there's been a reduction there. In the state prison system, that was a little slower, but there are COVID-19 infections in our prisons, and so we're starting to see a reduction. Some of us have been working very hard because California was a real pioneer in increasing mass incarceration, so a bad kind of pioneer. And so we've been trying to reduce the jail or the prison population for years, and we're having some success, but we need to get it down even more. It is incredibly bad and immoral and dangerous to have people who are in our custody. For whatever reason, they are in our custody, and we need to protect their health. These are also people who are more likely to have underlying health conditions and are more susceptible to COVID-19. So those reductions are happening. The state prison system needs to do more. In terms of homelessness, a few things. Before the legislature recessed in the middle of March, on the 16th of March, and by the way, we are hoping that we will go back into session. It might be remotely, but back in session May 3rd. That is the goal, so we can continue our session and do the work that needs to be done. But on the 16th, before we took a temporary recess for COVID-19, we passed a $1.1 billion emergency appropriation for the pandemic. And the state has already pushed out about 150 million of that to local communities specific for homelessness. So both the state and San Francisco are renting hotel rooms for our homeless population, and specifically for homeless people who have COVID-19 and homeless people who have underlying health conditions that put them at higher risk, which unfortunately is a sizable portion of our homeless population. And so there are, the mayor, I know her goal is to rent, I believe, 4,000 or 4,500 rooms. Some on the Board of Supervisors would like to increase that number. I think it's terrific. It's a way of so that people aren't in congregate settings. We can get them into individual rooms. One of the in terms of we all want it to happen faster. One of the things that limits the speed is not getting the room because these hotels are empty. They're available, and FEMA reimburses us for 75% of the cost. But it's making sure we have the staffing that people are being taken care of. You can't just have a bellhop, take care of someone with a health condition unless that bellhop had a prior career in healthcare. You have to have people who have the qualifications to do that. That is in process, but that's what makes it not as fast as we want it to be. But it is happening. One thing that we need to be mindful of, there are some homeless people who they're in some sort of shelter setting that they are content with that setting, and they're hesitant to go to a hotel because they're worried they're not going to get, when it's over, that they're not going to get their shelter bed back. And we need to make sure that people have peace of mind that this is temporary, and that whatever they have now that they are okay with, that they're going to have the option of going back to that. So those are a few things that are happening. We need to do more, but I think there's a pretty broad commitment to the homeless population here.
Great. Thank you for that answer, and thank you for the question, Jennifer. Diana from San Francisco asks, what is your stance on a rent freeze?
Sure. So there are two things here. Number one, we need to make sure that during this state of emergency, when we are asking people to focus on one thing and one thing only, to stay home, to stay healthy, to protect your health, to protect your family's health, to protect everyone's health by staying home. We want to make sure that people are not being evicted or set up for eviction during this period. And so that's why I am co-authoring legislation that Phil Ting is proposing to put a strict moratorium on evictions during this state of emergency. You may have seen, Mayor Breed issued an executive order with a strong eviction moratorium. I support that. San Mateo County Board of Supervisors passed legislation with a strong eviction moratorium, and I support that. That executive order that did not go as far as I and others wanted it to go, and so we have been advocating to try to make that stronger. I joined with Assembly members Chu and Ting to ask San Francisco Superior Court not to process eviction lawsuits, just to stop them unless there's a safety issue. They did do that, and then the Chief Justice of the California Supreme Court and the Judicial Council put a statewide moratorium on eviction default judgments. So there are some good things happening, but more to do. But the second piece of it, we want to keep people stable now. We also want to make sure that once this emergency ends, we don't then experience mass evictions at the end of the emergency. And that can happen in two ways. Under the governor's executive order, one of our concerns is that a landlord can still serve a 3-day notice to pay rent or quit. And at the end of those 3 days, technically the lease is forfeited. We don't want that to happen. There are so many renters in San Francisco, in San Mateo County, elsewhere, who do not have money to pay rent. They just don't have the money. They've lost their jobs. And even if with the increased unemployment up to $1,050 a week, that's great. That will help some renters pay rent. They don't have that money yet. They have to apply. There's always a delay. The state is very backlogged because of the deluge. And so as of April 1st, there were people who couldn't pay rent. As of May 1st, there will be even more people who won't be able to pay rent. And so we want to keep them stable now, but then at the end, we don't want them to have a paper eviction so that they can't be evicted during the emergency, but the landlord can just kick them out the day the emergency ends. That's bad. We also don't want renters to then have, let's say, 2 months or 3 months of back rent on the day that the emergency ends, because that will result in mass evictions. And then we also don't want a situation where you have landlords who have mortgages, who they then are not getting the rent and they get foreclosed on, and then corporations like Blackstone and other big real estate corporations come in and buy out all of the smaller landlords. That's not in anyone's interest. So at the end of this, we have to have an equitable way where renters are able to pay back rent or a portion of back rent over time, and we should be providing aid, and particularly federal aid, to renters to help them pay that rent. I would like the next stimulus to have money specific for renters to be able to help pay their rent. And we also need to make sure that homeowners, excuse me, who have fallen behind on their mortgage payments don't have to pay their mortgage payments immediately. So we need a solution that is equitable. And the legislation that Phil Ting is proposing, that I'm co-authoring, there will be, for the year after the emergency, there will be a reduction in rent, and then the back rent will be paid off over the course of a year. I'm sure there are other ideas as well, but we have to keep people stable in their housing now and after the emergency ends.
Great. All right. Thank you for that question, Diana. Next question from Vivek, also from San Francisco. How are we going to roll back shelter in place in a safe, responsible manner? What is a reasonable timeline, and what are reasonable expectations to have regarding removing some of the restrictions that are in place? And Senator, this question really hits on what all of us are talking about right now is, when are we going to go back to normal? What's going to happen when we go back to normal? And I sense it's not going to happen all at once, that maybe you can go back to church, but let's forget rock festivals for a while, that kind of thing. Elaborate on that from your perspective.
So first, in terms of the broader issue of when are we going back to normal, I think well, in some ways, I hope that in one way, and there are some ways in which we should not go back to normal. I hope that this crisis causes us to see some of the faults in our public policy and our society that are hurting people. I hope that we don't go back to the normal of not having a good social safety net. I hope we do not go back to the normal of having a fragmented healthcare system that's dependent on whether you have a job. I hope we do not go back to the normal of having mass homelessness. I hope that we as a society look at these problems that have been with us, but they've been sometimes a little bit off of a lot of people's radars. And I hope we don't go back to that normal. But in terms of more just like normal life and interactions, we will go back to that normal. Just like after the 1918 flu pandemic, there was, it was bad for a while, but eventually you go back to normal. And there will be treatments developed here. There's a very good chance that we will have a vaccine. But until we have rock solid treatments and then a vaccine, and that could be a year or longer, life is going to be at least somewhat different.
Okay.
In terms of when shelter in place will end, I cannot say, and I don't want to speculate. That is a public health decision that our health officials, in consultation with our political leadership, will make. It would be great if it ended May 3rd, but it may not end May 3rd. It may be extended depending on what the trajectory of the pandemic is in San Francisco and the Bay Area, in terms of the rate of infections and whether it's going up or down, hospitalizations, deaths. It's going to depend on what our hospital capacity is. If our hospitals are close to being tapped out, that argues against de-escalating the shelter in place. If we have good capacity in our hospitals, that might argue in favor of a shorter timeline. So I don't want to sit here and say a date. I would like to see it happen sooner rather than later, so people can get back to their lives and we can get the economy going again. But that will be a public health decision. And what we're doing now, by persisting in staying at home and honoring this public health order, if we do that not just last week, but now, and even though there are some good indications, people should not let up. We have to keep going, and that will shorten this shelter in place. In terms of what a de-escalation might look like, ideally we would have mass testing. So we're testing huge numbers of people. That's been a debacle during this pandemic in the U.S. We need to test people. We need to be doing antibody tests so we know who has already had it and who is now likely immune. We need to have the public health infrastructure so that as we're testing people, we can then quarantine the person who's positive and then trace all of the contacts that person has so those people can shelter in place and in the event that they were infected. But the problem is in this country, we've let our public health infrastructure, not really San Francisco, we have a great, amazing Department of Public Health, but in the US generally, we've not invested in public health infrastructure. We've let it atrophy. We need to ramp it up, ramp up the testing. We're going to be able to do antibody testing. We got to do that. And people still will need to observe social distancing, and in that we will not be able to have massive gatherings. There will probably be some sort of limit. Restaurants will have to have spaced tables so people aren't packed in together. Bars and other places will probably have smaller lower caps of people. So I think those are some of the things that we could see.
Great. Thank you for that question, Vivek. You are watching a live town hall with California State Senator Scott Wiener from San Francisco. He is answering your questions. And back to the questions we go here. Shanna asks, how are you and your office helping to support San Francisco nonprofits who are hurting as a result of the COVID-19 crisis, particularly those who lean primarily on volunteers and therefore are not the target audience for the Small Business Administration's Payroll Protection Program loans?
Yeah, so a few things. I mentioned that I've introduced legislation. It's Senate Bill 939 that puts a moratorium on commercial evictions, businesses and nonprofits during the emergency. We want to make sure that our small businesses are stable and have a shot at reopening, and we want to make sure that our amazing network of nonprofits are able to keep their space, whether it's an office or some sort of community or retail space, and reopen. So that's one thing. You're right. The federal small business loan program does apply to nonprofits, and yes, if you have a payroll, is when it's most beneficial because it can be a forgivable loan if you don't lay off your staff. But there are many, many, many nonprofits who are already seeking those loans and will be able to survive as a result. The city of San Francisco has, I believe, put together a fund for the arts. I think there should be a fund at the state level for particularly for smaller nonprofits that may not be able to take as much advantage of the federal small business loans. We absolutely need to provide a safety net for our community-based nonprofits. These are organizations that provide absolutely essential support and services for our community.
Right. All right. Thank you for that question. Jonathan asks or mentions, my sister is a victim of domestic violence and consequently has a substance abuse problem. She was scheduled to be admitted to a 120 inpatient residential treatment program on March 11th. However, all admissions are on hold. What treatment options or resources exist in the meantime while inpatient programs are not admitting new residents?
So this is a big problem of people experiencing mental health and substance use issues. And of course, addiction is a mental health issue, and so we need to treat it as such. And it is definitely because of the shelter-in-place order, those services and meetings and 12-step programs are not able to function in the same way, and it is definitely it is harming the ability of people who are in recovery to have access to all of the services and support that they need. So I want to just acknowledge that. There are, and I have just some notes here, there are still things happening online. There are meetings and support groups happening online. There are therapists and counselors for people with addiction who are still conducting their services online. It's virtual, so it's not quite the same as in person, but they are doing that. And then there are a number of helplines, and if you want to, I can just say a few of them here. There's the Disaster Distress Helpline, which is 800-985-5990, or text Talk With Us to 66746. There's the Crisis Hotline, which is the Warm Line, which I helped get funding for, run by the Mental Health Association of San Francisco. text MHA to 741-741. There's a national domestic violence hotline. That's not precisely your question, but because you mentioned domestic violence, 800-799-7233, and the caregiver help desk, which is 855-227-3640. So I don't want to pretend like there aren't issues here. I think the mental health and addiction ramifications of this pandemic in general and the trauma it's causing and disconnecting people from their supports, it's something we're going to have to grapple with as we move away from shelter in place. It's going to cause some real problems. So I'm sorry not to have a perfect answer, but we're not in a perfect situation.
Okay. All right, thank you for that question, and sincere best wishes to you and your family, Jonathan. Next question is from Lisa. I was a full-time contract employee and was let go since the company faced financial pressures due to COVID-19. I see conflicting info about when to file unemployment. Some say as self-employed contract worker, I should wait until updates are made online, and some info says to apply now, which is correct.
Yeah, so for people who haven't followed the details here, one of the great things that came out of the federal economic rescue was twofold. It increased unemployment. So right now, the maximum weekly unemployment you can get in California is $450 per week for 26 weeks. And the federal law added $600 to that. So now the highest is $1,050 in California and added 13 weeks to it. In addition, the federal law for the first time expanded unemployment, not just to W-2 employees, but also to freelancers, independent contractors, self-employed people. That's a huge expansion, and it is very, very overdue. Because it's brand new, both the $600, the add-on, and the freelancer independent contractor part, it has taken some time for the federal government to get the process in place and to get guidance to the states. California has just received the official guidance from the U.S. Department of Labor for the freelancer independent contractor part, I believe this past weekend, like on Sunday, so it's only been a few days. In addition, the $600 piece, that federal funding, those funds had to be officially, like the logistics of appropriating them and getting them out to the states. So there has been some delay, and of course, EDD, the agency that administers unemployment, has been overwhelmed. More applications in the last few weeks than in the entirety of 2019. Their phone lines are only open 4 hours a day because they spend the rest of the day all hands on deck processing applications and getting checks out. So it's best to do it online if you at all can. But in terms of for independent contractors, whether to do it now or wait, I would suggest doing it now. And the reason is that even though it may take some additional time, it's better to get into the queue, even if it's not perfect. In addition, for everyone, you're going to initially probably just get the $450. The $600 may not be ready yet, but you will then, once it is available, you'll automatically get it without be retroactive. So for the freelancer independent contractor, I would suggest that you do it now, but feel free to also contact my office for further support and advice, because my staff is dealing with this issue every day.
All right. Thank you very much for that question. The next question is Philippe asking, at our public elementary and middle schools, we have noticed that many students do not have computers or internet access at home. As with healthcare, is it time to consider universal access to computers? In other words, Chromebooks cost about $150 or less directly from Google for schools, so access to that and to the internet.
Yes and yes. We should have absolutely, first of all, universal access to the internet. The digital divide is huge, it's big, and it's real in San Francisco, and it's real throughout the state and throughout the country, and it really contributes to long-term income inequality. And so we should have guaranteed internet access. I'm a believer in municipal broadband. We should have a municipally owned broadband service. The city of San Francisco owns an enormous amount of internet infrastructure under the streets, and we should be using that. And then, yes, absolutely, every child that cannot, or if a family cannot, it's just like free and reduced lunch. If you can't afford the hardware that you need to really fully participate in school, particularly if it's not, that should be provided to you publicly.
All right. Thank you very much for that question, Philippe. Alex asks, the PPEs, which is the personal protection equipment used by the hospital workers, the PPEs and the ventilators are in short supply nationwide. What is being done to make sure that our hospitals are prepared for a potential surge in infections and ensure that our health service workers are properly protected?
Yeah, it's really critically important. And for those who aren't, if you're able to, but if you're not watching the governor's daily updates, he does an update every day at noon. It's streamed on usually on his Twitter account and/or Facebook page, and he goes into a lot of depth about where we are with hospital capacity, with PPE, with ventilators. We are starting to do better. We've been surging our hospital capacity statewide. For example, in our neck of the woods, the state has leased hundreds of beds from Seton Hospital in Daly City, which was a big win. The state is reopening the closed California Pacific Medical Center campus on Buchanan. That won't be used for COVID patients, but it won't be used in like an emergency ICU setting, but it'll be more of a step down location. And so we're trying to expand the number of beds and the number of ICU beds. And all the hospitals have contingency plans to put tents up with additional beds. So that surge capacity is not exactly where we need it to be. There's still a ways to go, but we're moving in a good direction. In addition, our hospitals right now, particularly in San Francisco, are not being overwhelmed. It could happen if people don't keep doing the right thing, but right now it's not happening, and neither is our ICU capacity. In terms of ventilators, California has been accumulating more ventilators, and Governor Newsom, actually, you may have seen in the news, recently loaned 500 of our ventilators to New York and New Jersey, who are in desperate need. And he's doing that since we have very little leadership coming out of the White House. And I'm not trying to be partisan, but to me, it's objective that the president has dramatically dropped the ball on this pandemic from the very beginning, when he dismissed it as the flu and was going to go away quickly and it's a hoax and all that, to now where he refuses to play traffic cop, which should be the federal government's role in terms of making sure that states have access to the equipment and the PPE that they need. So he's allowing it to be a little bit like I forget the name of the book. Anyway, each for their own, every state.
I wish I could help you there. I was trying to think of what you were talking about.
Lord of the Flies.
Lord of the Flies. Yes, right, yes.
Where the states are like put into like a mosh pit and have to like fight each other and try to outbid each other on eBay for this equipment. So the states, I think, are starting to work together and form networks to support each other. And so Governor Newsom is loaning these ventilators because we're doing okay now. We'll get them back, and then at some point we'll probably need more, and other states will loan them to us. In terms of PPE, that is also heading in a better trajectory. The governor has been able to secure an enormous number of masks, for example, and so we're moving in a good direction. We're not where we need to be. We're moving there. Seton Hospital was in a bad place where they were within a week of running out of most of their PPE, and they now have the equipment and the gear that they need.
Right, that's reassuring news. Thank you very much for that question. Alexi asks, I've been trying to find some place to donate blood, but the Red Cross app says all drives for the next 2 weeks are full. Is this for real? Should I stop trying? And Senator, if I can suggest as you answer this question, also tee off and explain, if you have time there, about the blood drive you held yesterday in San Francisco and the circumstances around that.
Yes, this is a good question. So we have a blood shortage that is growing and is becoming severe in this country because of COVID-19. you don't typically need a blood transfusion, I don't think, for COVID-19, but other people do. And people are donating a lot less blood now because of the shelter-in-place orders throughout the country. And in addition, our blood banks have had to scale back some of their capacity because of social distancing. You can't process, as many people per square foot as you normally would. You have to space people out, you have to space your employees out, and so it's been very challenging. We're working with the Red Cross to try to ramp up their capacity. Yesterday, I co-sponsored with the Red Cross what we call it a Give for a Gay blood drive to, first of all, try to get people to give blood. And the slots did fill up in about 10 minutes. And also to highlight the fact that gay and bisexual men continue to be effectively banned from donating blood. I can't donate blood because the FDA has a celibacy requirement. It was a year of celibacy in order to be eligible if you were a gay or bisexual man. Now it's 3 months. It's effectively a ban, and there's no scientific basis for it because of how precise HIV testing of blood is. And so it's discriminatory. Sexually active straight people are not subject to the same restriction. So we're trying to get the FDA to get rid of this rule. We are going to do another Give for a Gay blood drive on April 30th. If you want to contact my office, we can see if we can try to reserve a slot for you. But the capacity is not where it was before this crisis. So it's a twofold thing. Its capacity is restricted because of social distancing, and there are people who don't want to go out and contribute. But like I said, we're working with the Red Cross to try to ramp up capacity. We have secured a location where we held the blood drive yesterday. It's a rehearsal space for the War Memorial near City Hall. It's not being used for anything now, and so we can use it as many times as we want. So hopefully that will ramp up. So keep trying, and do feel free to contact my office about our April 30th blood drive.
And in some leadership solidarity, I know Mayor London Breed gave blood on your behalf yesterday, right?
Yes, I should have mentioned that. Like I said, it's Give for a Gay, and when we say Give for a Gay, what it means is that if you're a gay or bisexual man who's banned, find someone who is able to give on your behalf. And if you are someone who can give on behalf of a friend who is banned. And so I asked Mayor Breed to give blood on my behalf. She agreed to do so. I'm very grateful for that. And then Supervisor Catherine Stephanie from the northern part of the city gave blood on behalf of my successor on the Board of Supervisors, Raphael Mandelman.
All right, that's great to hear. Thank you for that question, Alex. And now from Alex, don't know if it's the same Alex or a different Alex, but we're ecumenical, so all Alexes are welcome here. Do you have any updates on SB 50 or similar legislation designed to combat the housing crisis? Now more than ever, it is going to be critical to ensure that housing and rental prices are affordable for all families in California. So I guess you'd say amen to that.
Yes, I would say amen. In terms of an update on SB 50, SB 50 is a housing bill that I authored to legalize more housing near public transportation and near job centers. We have a multi-million home shortage. Which has exploded housing costs, and as we build those millions of homes, what we don't want to do is build sprawl. We should be focusing the housing near jobs, near public transit. That's what SB 50 would have done. SB 50 is no longer extant, if that is the right word. It was defeated on the Senate floor in a very close vote, and it was disappointing, but that is a bill that a few years ago would have gotten laughed out of the Capitol the minute it was introduced, and we then got it through multiple committees and came within a whisker of getting it off the Senate floor. So it was progress, even though we were disappointed. I've since introduced two housing bills, SB 899, which will allow churches and other nonprofits to use their excess land to build affordable housing, even if the local city won't let them, which is often the case. A lot of churches in particular want to build low-income senior housing or housing for formerly homeless people, and SB 899 will allow them to do that. And SB 902, which provides that statewide cities have to allow 2-unit, 3-unit, or 4-unit buildings, depending on the size of the city, so small multi-unit. and give cities, if they want, the ability to quickly zone up to 10 unit apartment buildings. If the city wants to do it, it gives them a very fast, easy way to do it. So a combination of setting baseline zoning of 2, 3, or 4 units, and then giving cities an easy way to take it up to 10 units if they want to. We're going to see, because of a law that I authored and we passed a year in 2018, the housing goals that cities are receiving in the current housing goal cycle that we're in are going up dramatically. I mean, really significantly, which is great because they were way too low before. Southern California just went through its process and their housing goals tripled. And there were cities like Beverly Hills in the previous cycle, they had a housing goal of 3. They now have a housing goal of 3,000. Santa Monica's housing goals went from 1,700 to 9,600. This is over an 8-year period. The Bay Area will go through its process starting the end of this year, and our numbers are going to go up significantly. So SB 902 will give cities a tool to be able to quickly and easily rezone for more density. But in terms of your concern, which I share, housing is still an issue. We're very focused on COVID-19 now. It's priority 1, 2, and 3. We're in a pandemic, but people still need a place to live. And the housing crisis and emergency that we had before COVID-19 is still around now and will still be around after we have a vaccine for the coronavirus. And so we need to really stay the course in moving towards a future where we have abundant and affordable and available housing for all Californians.
All right. Thank you for that question, Alex. Dylan asks, hello, I am the owner of the businesses at the Swedish American Hall in San Francisco. We host private events such as weddings and conferences, as well as public concerts and performances. Much of the dialogue around relief for small businesses that had to shut seems to assume that they will open back as normal within a matter of months. What about businesses that cater to gatherings of over 250 people that will likely be closed for a much longer period, perhaps up to a year? Will there be special relief for event businesses that are small independent companies that have been hit especially hard?
Yes. Hi, Dylan. I know you. And I know the Swedish American Hall well. It's about 4 blocks or 3 blocks from where I live. It's an amazing, amazing place. And I hope when this all passes, everyone needs to go to the Swedish American Hall. It's a beautiful landmark building, wonderful live music, great restaurant, bar. It's just fantastic. Cafe du Nord. Yes, there needs to be support for these venues that are going to probably be later in the process because they cater to larger events. I think at the Swedish American Hall, there's also the restaurant, the bar. I don't think that the venue is going to have to be completely shut down, but you're right, you won't be able to host the same number of people. And again, I don't want to speculate because I don't know exactly what the revised order is going to be. But we clearly have to have a very big investment in supporting particularly small businesses of different stripes and recognizing that they're not all the same. And some are going to be closed longer than others. So that is very much on the radar.
All right, great. Thank you for that question. Alan asks, hello, Alan. Hi there. The state of California's order for staying at home says until further notice, quote unquote, but the San Francisco order goes until May 3rd, which takes precedence. Thank you, Senator. I know you've alluded to this already a little bit, but some more clarity on that.
Yeah, well, so I mean, theoretically speaking, if the Bay Area order, which the 6 counties have all done together, were to expire and nothing happened with the state order, we would be bound by the state order. We're bound by both of them now. But with that said, and again, I've never spoken to the governor about this. I'm not speaking for him. I can't speak for him. I don't speak for him. But what I will say is, I believe that if the Bay Area, the 6 Bay Area counties, which frankly were the most proactive and strong about this, and they took the first step, if the health officers in the 6 Bay Area counties come together and say, we're ready to end shelter in place and to transition to a less restrictive approach. But let's say the governor wasn't ready to rescind his statewide order because of other parts of the state. I have to believe that the governor would give a lot of deference to a region that came together in a thoughtful way and said, we're ready to move on. I would be shocked if the governor didn't provide deference to that. So I don't think that'll be an issue.
All right, great. Thank you for that question. Another question, or from Alex, or another Alex again. Hospitals were provided with vastly inadequate numbers of tests for COVID-19 in February and March. Testing availability has improved, but per the website he lists here from the City and County of San Francisco, sf.gov, find out how to get tested coronavirus. Testing resources cannot meet demand. That's a quote, I assume, from that website. Given that people can be infected and completely asymptomatic, is there a plan to make testing available to everyone, including those without symptoms?
Well, you are absolutely right that currently we do not have enough testing kits. There are more and more testing technologies coming into existence, which is good. But this has been absolute debacle. There's no other way to describe it. A national debacle around the lack of testing. And it's one of the things that has made this pandemic worse in the US. We are moving in the right direction on testing. Testing is becoming more available. If you compare the availability of testing and the number of people being tested today to 2 or 3 weeks ago, I don't have those numbers in front of me, but it's a significant difference. And I think we're going to see a continued acceleration. And I will bet my lunch at 3 or 4 weeks from now, it's going to be really significantly higher than it is now. So we're not where we need to be, but we are in a better place than we were 2, 3, 4 weeks ago. And we will be in a better place 2, 3, 4 weeks from now. It is a priority, I know, for the governor and for our mayor and for all the powers that be, I know, in California, and I know also other states too, that we must have ample testing, because the way that you are able to scale back the shelter-in-place order and start returning to degrees of normalcy, the way you do that without causing another explosion of infections is to have good testing and tracing, and then in addition, the antibody tests that I referred to earlier.
All right, thank you very much. You are watching this live town hall. State Senator Scott Wiener from San Francisco answering your questions, and more questions we go back to. Haley from San Francisco asks, greeting to you. I wanted to ask, what can the state of California do for student nurses currently enrolled in their nursing programs and the ability to progress? The BRN, I assume that's the Board of Registered Nursing, correct me if I'm wrong, is only allotting 50% of in-person clinical hours to count. However, nursing students are unable to attend clinical at this time. What measures can be taken to help students progress through their programs in order not to be held back?
Yeah, this has been a real challenge, and I'm a supporter of making sure that our nursing students can, get their, graduate, get their license, and start helping out. And so what happened was the rule was that of your clinical hours to be eligible to graduate, 75% of them had to come from, being in a clinical setting with patients. The governor issued an executive order, and then the Board of Registered Nursing reduced the 75% to 50%. So they loosened it up. I understand that that can still be a challenge, but it's less problematic than when it was at 75%. A lot of the nursing schools, when this first started, just sort of shut down. They were not doing clinical hours. My understanding is some of the nursing schools are now starting to do provide clinical hours again. And one other thing to note is that the governor issued an executive order last week creating something called Health Corps, which is a way for nursing students, med students, and then also retired and former healthcare workers, but especially med students and nursing students, allowing them to come into the healthcare workforce to help fight COVID-19. And so nursing students are eligible, and maybe you've applied to Health Corps already. And if you do Health Corps, those hours, my understanding is, will count towards your clinical hours. Double checking on that, but that's what I have been informed. So I don't have a perfect answer here, but I think there are things that have been loosening up to say, we have this huge pool of nursing students who are very close to being able to graduate. They're not like, first semester nursing students. These are, towards the end of the process, or medical students who are on the verge of graduating. Let's tap into that resource, understanding the limitations, but tap into it and I support that, and I think we're moving in that direction.
Right. Thank you for that question, Haley. Robert asks, how can I purchase food? My husband and I are not allowed to leave because we're in a high-risk category. That really narrows down to really one of the key challenges here in this pandemic is access to vital services, vital nutrition like food. What's your comment, Senator?
So a few things, and again, I don't know what your exact situation is. A lot of the supermarkets have reserved time just for people who are seniors. You know, I think my neighborhood market, it's like 7 to 8 or 8 to 9 in the morning is only for seniors. And I know there were some issues with some people violating that, but I've also gotten some good feedback that it works. So if I don't compromise that you can't even do that, but that does exist. And then, of course, you know, I think it's important for all of us to be checking in on people we know who are older or who have underlying conditions to see if we can go shopping for people. There are also some nonprofits that will deliver food, and my office can get you that information. And you know, but it is it's a little bit ad hoc, and I don't know who you have in your life that maybe could go shopping on your behalf, whether it's a neighbor or a friend. That would be ideal. And again, it's a reminder to all of us to be checking in on people who are higher risk to say, are you okay? Do you need anything? Do you need me to go out and go shopping for you? Do you need me to pick anything up for you? Is there anything you need?
Right. Best of luck to you, Robert. Thank you very much for that question. Jack from Daly City asks, basic necessities like toilet paper, hand sanitizer, and disinfecting wipes are still in short supply. What steps is the city taking to address these shortages and ensure everyone has access to supplies? It is sort of interesting that one of the iconic and ironic memories of this pandemic is going to be the run on toilet paper of all things. So, what's your response?
Well, I remember back. I'll date myself when I was a kid, a teenager in the 70s and 80s. We had the Soviet Union, and that was the big thing that you couldn't get. It was hard to get toilet paper in the Soviet Union, and toilet paper was abundant in the U.S. It is, yeah. I don't think the city really. That's a. I mean, it's a both a supply chain issue, and just a run on these products. I have noticed that pharmacies, grocery stores are putting limits on how much of it you can buy. You can only buy a couple rolls of toilet paper, or I mean the corner stores near me. When I always ask them how's it going when I periodically go in to get necessities, and they say they don't even get hand sanitizer anymore. The Purell just doesn't come. The toilet paper comes, and within 30 minutes it's gone. But I think it's important for the stores to put limits on how much people can buy. And I think people need to not hoard. It's not appropriate. Just get enough for what you need and maybe a little bit more. People need to stop hoarding. And with the hand sanitizer, I have no idea like when that's coming back. It's just there. It's
yes.
I wish the city could solve it, but I don't think the city can.
Right, absolutely. All right, thank you very much for that question. Stephen from San Francisco asks, I am a current city and county of San Francisco employee, and I am concerned about the $1.7 billion projected budget deficit. I assume he means city and county budget. Are there state funds available to help the city county cover these shortfalls?
Well, thank you for your service to our city as a former employee of the city. The deputy city attorney, and then member of the board of supervisors. I wanted to thank you for your service to our city. The city's budget is my first year on the board of supervisors was 2011 when we had a $500 or $600 million shortfall, and it was ugly. It was very ugly, and it's going to be very difficult the next few years for the city of San Francisco. Unfortunately, it's going to be very difficult for the state as well. We have not gotten projections yet for what our shortfall is going to be, but it is going to be a severe shortfall, particularly since the state is overly reliant on the two most volatile sources of revenue, which are capital gains taxes and income taxes on high earners. And even though I'm a strong supporter of progressive taxation, we don't have enough of a mix of revenues, and so that's why we have boom bust budgets. We do have a $20 billion reserve for rainy days, but that will be backfilling critical services for in-home health services and foster care services and homeless services and so forth, public education. So I don't. I think the state will do some things to help cities whose fiscal situations are deteriorating, but because the state cannot go into deficit spending, we have to balance our own budget. There are limits to what we can do for cities, but that will be a topic of conversation. Now, the federal government can do deficit spending, and it is doing deficit spending. And so there was a big pot of money in the recent economic rescue for state and local governments. The state of California will receive, I believe, $13.5 billion of that, and that will be divided between the state and local governments. So San Francisco will get some portion of that. It's not enough, and in the next rescue package, they need to provide a lot more for state and local governments. So I'm hopeful that the federal government will do that.
Right. Thank you for that question. Senator, we've clocked an hour already here. We still have questions coming in. My time is your time. If you're here, we'll continue on with these. So
yeah, why don't we do 2 or 3 more?
Okay, sounds good. Dan from San Francisco asks, what resources do renters have available to find relief? And I know you've already touched on evictions and other things, but anything else you can add?
No, I mean, we want to, first of all, people should not be getting eviction notices if you're not paying your rent. There are certain steps you have to take. You have to notify your landlord that you're unable to pay because of COVID-19, and you're supposed to save documentation. But if people should not be receiving eviction notices, I'd like to know about that if people are. There are also great organizations in San Francisco that provide counseling and other support. The Tenderloin Housing Clinic, the Housing Rights Committee, and others that can provide support. And my office can make some of those referrals. And so if you are getting an eviction notice, please let us know. In terms of funding for tenants to pay rent, I would like to see the next federal stimulus include specific money to help renters make the rent. But one of the good things about the increase in unemployment from a maximum of $450 to a maximum of $1,050 per week, and the expansion to freelancers, independent contractors, self-employed, is that will help at least some people make rent, although it's too slow in getting those payments.
All right, thank you very much. This will be our last question, Senator, actually. Lorena from Daly City. My husband is a healthcare provider, and since he is an essential worker, he still works regularly. Since he's been possibly exposing himself and us, his family, to COVID-19, is he and all workers like him entitled to hazard pay? Thanks for the question and the answer.
Yeah, they should be entitled to hazard pay. Right now, they're not. Individual hospitals could decide to provide them hazard pay, although the hospitals are in bad financial shape because they've eliminated all of the elective surgeries, which is how they, which is the most profitable procedures for them. So that's why there was money in the federal bailout just to shore up the hospitals and keep them sound. So the answer is he's probably not going to get hazard pay or not entitled to it. I think he should be. These healthcare workers, as well as frontline pharmacy, supermarket, delivery workers, these are people who are putting themselves in risk so that we have healthcare or delivery services or food or pharmacy, medicine. They should be getting more money. And speaking of which, delivery, to the people who asked before about getting food because they're seniors and can't go out, there are food delivery services. They tend to get backlogged, so you should plan in advance and not try to order on the same day or the day before you want. Do it in advance, and you should be able to get it delivered to your home. My parents, I mentioned, who are elderly, they don't live in California, but my mother is no longer going to the supermarket, and they're having their groceries delivered instead.
All right. Senator, thank you all of you for these very thoughtful and important questions. Senator, thank you for this time. I know you are not in Sacramento, but you are on the ground, you are on the phones, your staff, you are working this as best as possible in collaboration with local government as well and other state leaders. Any parting comments you want to make to those watching regarding what's going on and what's ahead?
Yeah, what I want to say is it's hard to imagine going through something as more difficult than what we're going through. There have been terrible periods in human history, wars and genocides and terrible pandemics. But this is very, very bad. It's harming a lot of people. And I think for a lot of us, it's really easy to get down when we see people, know of people who are getting sick or dying, and people who are not working, who can't pay the rent, maybe who are struggling with food. It's hard. But what I will say is that we are in this together, and we are going to move through this and get out of this together. And we will mourn the people that we have lost, and we will support the people who need support. But we're going to get through this, and we just have to stay strong and resilient, and we need to stick together, and that's how we're going to do it. So, and thank you for the honor of allowing me to represent you in general, and particularly during this difficult time. Thank you.
Senator, you mentioned, thank you for that, for sharing that. You mentioned at the outset remembering the Passover observance, and there was a phrase in Hebrew that I ran across recently, and hopefully I'm saying it correctly, Gam zu el tova, which, if I'm translating it correctly, means this too shall be for the good. And I know there's going to be a lot of scar tissue, figuratively and literally, coming out of this. And as you're talking about, we are all in unity and working together. And referencing what you also said earlier about the normal, what we hope to see as the normal from this, there's still going to be a lot of good that can come out of this.
There can be, and if this gives us the impetus to move towards true universal health care, and I'm a supporter of single payer healthcare, Medicare for all. But moving really towards a truly global, comprehensive approach. It's not dependent on whether you have a job or what contracts with health insurance companies your employer entered into. That will be a good thing. If we can truly shore up the safety net to say that no one should ever have to struggle with food, that food should be a right, that'll be a good thing. If we make sure that every worker has access to paid sick leave and to paid family leave, which they don't now, that'll be a good thing. And so there are really good things that can come out of this. When you look at the Great Depression in the 30s, it's so devastating to so many people. But coming out of that, we got Social Security, we got all of our modern approach to a social safety net, which has been frayed over time, but there are good things that can come out of terrible catastrophes.
Right. On that thoughtful note, we'll wrap this up. Senator, thank you so much for your time and your wisdom and your legislative work. And I wish you and your family and the good folks of the 11th Senate District continued good health and peace of mind. Thank you for joining us on this live town hall.
Thank you so much.
All right, thank you. State Senator Scott Wiener from the 11th Senate District, the city and county of San Francisco and environments nearby. And that same wish goes to all of you who are watching right now. We wish you good health and peace of mind. Reminder that this particular town hall will be archived in this place or nearby. So if you want to review it or encourage someone who missed the live broadcast, the live stream, to review it, you are welcome to log back in and find the archive of this live stream, at least in the same place until further notice. That wraps us up here for this live town hall with State Senator Scott Wiener talking to us from San Francisco. From Sacramento at the state capitol, I'm Brian Green. Be well, everyone, and thanks for watching.